So you want,
All righty. Hello, everyone. Thank you for joining us. We're going to give it just a few more minutes here before we get started.
all righty.
Hi, Dr. Seville.
Trish, you're looking sharp as usual.
Thanks. Um, Attendees, your camera is off and you are muted. That is correct. We'll talk a little bit about asking questions here in just a moment when we get started. I know we jumped on about 15 minutes ago, and Dr. Lee and Dr. Rowans was going on and on about working together, and I was like, "Wait, you guys
We've completed the webinar.
I'm like, well, repeat everything you just said once we get started.
You
so I
recorded
can
it,
tell
right?
you this is going to
We're
be a
done.
really wonderful webinar. So
Yeah,
thank
15
you all for
minutes, we nailed
joining us.
every point, we're done.
Right.
Are you all still at your practices at your office? Dr. Ely,
Pardon me?
Yes. Yeah. Well,
I didn't hear what you said, Frank.
Oh, you're still at your office, I take it?
Well,
Yes.
I went home and I came back.
Oh, right. Okay.
Went home, had dinner, hung out with the kids for a bit, and then realized that my dogs were not going to cooperate with doing the webinar. So came back.
I hear that,
Fair.
Supermom. I hear that. Yeah.
Yep.
I was working from home today and I decided to drive up to the office as well.
I know. I was going to say, I was like, you definitely were at home when I was talking to you earlier. We've had a few clinicians where we're doing webinars and kids have ran in the room, animals. It's fine. Got to do what you got to do, right?
The beauty of Zoom.
All right, everyone, we're going to give it just about one more minute here before we get started. Let everyone take a couple more minutes to log in.
I'm having some staff that's trying to still register last minute. Can they still register from the website?
They can, or I can chat you
Okay.
a link if that would be easier.
Well, I sent them the link, so.
Okay.
But I got it.
Yeah, that will give them an automatic link.
Okay.
And then we will, and for all the attendees, we are recording this, so that'll be an option as well. If you want to share that with them. Okay, everyone, let's go ahead and get started here. Good evening. Thank you all for joining us for our monthly webinar. I see a lot of familiar faces on there, which is always wonderful for you to all join us frequently. We host these webinars monthly for those of you who are joining us for the first time this evening. We always cover all things sleep and TMJ related, as well as practice growth in these areas. So if there's ever any specific topics you'd love us to cover, please feel free to drop them in the chat box or send me an email. We'd love to address those for you. A little bit about Zoom today. The best way to view the webinar is going to be in speaker view. So in the upper right-hand corner, if you click the view button, there's an option to select speaker view. That'll give you a nice side-by-side of both speakers today. And so you can kind of view everything that's going on. Your camera is off and you are muted for the webinar. That is correct. We will address questions at the end, so hang tight, keep your questions, or even feel free to put them in the chat box throughout the webinar so you don't forget them, and we'll address them at the end. So at the end, I can either unmute you and you can ask your question, or we can address them right from the chat box. So feel free either way, whichever works best for you. A little bit about the webinar that we're discussing today is specifically on bridging medicine and dentistry for better sleep. So an expert interview on oral appliance therapy. So like I mentioned, feel free to save those questions for the end. We will be addressing questions throughout the webinar. So those of you that have attended our webinars previously, this is a little bit of a different format than you've seen before. So we've compiled a lot of frequently asked questions, and we'll be asking Dr. Ely and Dr. Rowans to answer those. and based on their partnership and helping their patients. And Frank will be moderating this. So we'll have two speakers, and then Frank will be moderating. And so we will kind of work as more of a conversational format this evening. You will be receiving a promo code at the end for our digital appliances, so feel free to stick around. I'm excited to share that for you. So I'd like to start this evening by introducing Frank. So Frank Madrigal is our president and founder. He began as an RDA that transitioned to a lab technician, and he's been working as a technician for almost 30 years. In 1999, Frank started Frank's Dental Lab as a full-service lab, which quickly transitioned to True Function, which has been focusing strictly on sleep apnea and TMJ for almost 20 years. Frank truly is a wealth of knowledge on all aspects of sleep apnea, TMJ, and appliances. And over the years, he's worked alongside some of the top clinicians in the industry to develop and troubleshoot appliances, creating an efficient workflow for clinicians. In addition to his day-to-day of being president of True Function, he's always working behind the scenes to develop workflows to consistently enhance and digitize our current products, as well as create new and innovative appliance designs. Next, I want to introduce one of our dear friends here, Dr. Anju Ely. Dr. Ely is a diplomat for both the American Board of Dental Sleep Medicine and the American Sleep and Breathing Academy. She attended the University of Michigan, earning her Doctor of Dental Surgery degree in 1997. She is an active member of the Detroit District Dental Society, the American Dental Association, Michigan Dental Association, the American Academy of Oral Facial Pain, and the American Academy of Craniofacial Pain. She is on staff at the Ascension Hospital in Novi. Dr. Ely is on the board of directors for the Michigan Academy of Sleep Medicine. Dr. Ely also lectures nationally, educating other dentists about treatment of sleep apnea with oral appliance therapy. Throughout her 25+ years in private practice, she has maintained an emphasis on continuing education through a range of postgraduate courses that include an emphasis on dental sleep medicine, temporomandibular joint disorders, and pain. We're excited to introduce Dr. Bradley Rowans this evening as well. He works closely with Dr. Ely, so thank you for dragging him along with you, Dr. Ely, to attend our webinar this evening. So a little bit about Dr. Rowans. He attended the University of Michigan as well, and Wayne State University, and there he received his bachelor's in biology and his doctorate in medicine. He has done additional training in internal medicine and physical medicine and rehabilitation at Sinai Hospital in Detroit, as well as pulmonary and critical care medicine fellowship at Henry Ford Hospital in Detroit. He is a clinical assistant professor at Wayne State University and is currently the medical director at the Sleep Disorders Center, Henry Ford Province Novi Medical Center. He is a fellow of the American College of Chest Physicians and a member of the American Academy of Sleep Medicine. He has obtained a certification or license in the American Board of Internal Medicine, specializing in pulmonary medicine, the American Board of Internal Medicine, specializing in critical care medicine, the American Board of Sleep Medicine, specializing in behavioral sleep medicine, as well as the American Board of Internal Medicine, specializing in sleep medicine. He's also contributed to many publications and abstract articles pertaining to his field. So I'd like to thank you both so much for joining us this evening, and we're really looking forward to the information you're about to share. So I'll pass it over now to Frank, and Frank, you can go ahead and ask the first question.
Wonderful, wonderful. Thank you, Trish, for the kind introductions. And again, Dr. Rowans, Dr. Ely, thank you so much for your sharing your valuable time and knowledge. And we really appreciate you both for doing this. We'll get started. So I just wanted to say that we have a list of questions, and they may pertain to one or one or the other clinician, but please feel free to chime in and share your opinion.
Absolutely.
Either way. So great. So let's get started. So first question is, how can dentists best communicate with sleep physicians to ensure seamless collaboration and optimize patient care?
Well, I think that, communication is probably the key here. I try to keep, Dr. Rowans abreast of every time I see his patients. Soap notes. I think we have to be able to use soap notes because that's what they're used to in the medical field. And so, so that the physician can have a quick reference and know where their patient is at with their treatment. So I think that's important. What do you think, Brad?
Of course, the digital paper trail is really important too. But, I think back about, how we established our relationship, and it was face to face, and I think it was most likely you coming to see me.
It really
And
was.
I remember that, introducing yourself and developing the confidence and relationship that the communication is really important. It obviously goes back and forth because, you have to know what's going on day to day or month to month with patients. But in order to establish that at the beginning, it's really confidence, and being able to confidence and trust. Okay. And I think that from my perspective, the things that have happened through the years is people come and they go, and I've had, in all fairness, multiple probably qualified dentists come through the door, and it never felt like it was as serious as when you came in, and I could trust you. And some of it's you, and some of it's the actual person, I'm sure. But I think you have to develop that at the beginning, and that's what establishes, I think, the relationship that's going to be longstanding. Do you know what I mean?
Yeah, no, I agree. And I do think that in person, like you said, is really, really important. I even think back to even, this is something that I think dentists can relate to that are, watching this webinar, is even when I first established my dental practice, and there was, I'm specifically thinking about the oral surgeon that knocked on my door and said, "Hey, welcome to the neighborhood. I'm Dr. So-and-so. I'm up the street if you need anything. Here's my referral cards." Same thing with the root canal specialist that I work with. And it was the people that really did knock on my door and met me and shook my hand. And those are the people that I felt, when the situation arose and I needed somebody, that I was going to turn to. So, I think that I came to you hoping, A, that you would let me in the door, but I was looking for a mentor at the time as well. I wasn't a diplomat at the time when we started.
Oh, I know.
Right? So you helped me. I spent time with you in the sleep lab. I shadowed, your sleep techs when they were scoring sleep studies. You wrote me a letter of recommendation. I mean, you were there for me along the way, a big part of my journey.
That has a lot to do with you, of course. But it was their persistence, and it was the dedication that I think that's the difference. I mean, I have met other people, and they never showed the same interest, dedication. Hence, why would I develop a relationship with them, right? I think that's really, really important. I mean, I still, I think in our field, I still think that there are people that are fabricating devices. Do I think that they really believe in the field, or is it sort of another option? There's something else they're doing, right?
Yeah.
And that the other thing that always impressed me about you, and I think you could extrapolate that to people starting out, is a dedication to the field of sleep medicine and sleep dentistry. That is really, really important, because that's what I don't want to use the word, it impressed me so much that I've really felt that you were so serious about what you were doing and taking the field seriously.
I think that, so people on this call are probably wondering, like, what did you do? Like, what did I do that I imparted that impression to you that I was so serious about it? I mean, I knew I was serious, but how did I show you that? I don't know.
Well, I think perseverance and the time it took. I mean, it was a few years ago, obviously, but it wasn't that long ago. And our time is so important to us. And to be able to come and dedicate it and give your time up for this field really demonstrated to me that you had a real significant tract in trying to pursue this.
Yeah, I mean, definitely. Yeah. I mean, the passion was there for me from the beginning.
The passion, right?
Yeah, the passion, right? So yeah, it's turned into kind of a passion project for me in the sense that, and I know that some of this too, but my dad probably had really bad sleep apnea and probably died early in life because of it. So when I learned what it was, then, you know, that became, okay, this is definitely where my heart and soul is going to go to in my career.
Yeah, sure. So somebody starting out, you know, a dentist starting out would probably start by educating themselves, being really aware of what they're going to talk to the sleep physician about. And that education and dedication comes with that knowledge base. And that's probably the first thing that I'm trying to say. If I met someone de novo who walked in, I think that would impress me the most. Knowledge base, knowing what's going on, willing to sacrifice some of their time. And then the communication becomes pretty easy now, right?
What about the ease of referrals?
How so?
Like, what about the ease of referrals? So other physician or other dentists that have approached you, you know, like for us, we started out with our, you know, form that we had, like the RX form and our letter of medical necessity, and you would sign off on that. And now, because you can send it to me via fax, we just get the DME order via fax, right? So
Yeah, and you know, that was, you know, it's so funny you forget about that. Obviously, that was part of it. You did make it easy too, right? So,
yeah,
but it's probably easier now than it ever was, right?
right.
But I'm sure that's obviously that was paramount to the beginning too. You did make it easy for us to do the consultation and stuff like that. But you know, what I tell my patients is, and I unfortunately I can only say that about your practice, is that I know when I make the referral, they're going to hear from your office.
Yeah.
That's a confidence, and that's your office staff too. I mean, I'm totally confident that when the patient leaves my office, they're in great hands, even before you contact them, because I know you will, and I don't think there's ever been a time that you didn't, and that's a really comforting thing to know. And I can say that to the patient. There's no way you're not going to hear from them.
Right.
Right. And it's a great thing, because people leave the office, they never hear from anybody, they lose faith, they lose interest, and then they just disappear. Right.
Yeah.
So these are probably going to be non-compliant or difficult, troubling patients that have sleep disorder breathing with CPAP. And I want them to be contacted, and I don't have to call your office and say, hey, you never called them. Right.
Right.
So the follow-up, the confidence in the follow-up, so I think really important too.
Wonderful. Well, thank you both. You know, I heard quite a few things, of course, is just sharing that clarity in your why. You know, why do I do what I do? Why is it important? And sharing that passion, and you know, establishing that rapport and communication, and the follow through. You know, making sure you do what you said you were going to do, and how important it is to Dr. Rollins. So, thank you both.
Yeah, yeah. I think I've really never worked with a physician that I had such confidence in. And what I'm thinking here, what I hear is that what we have to do is sort of learn from this relationship and pick it apart and try to figure out why it was so successful.
Right,
Right.
because that's people
Yeah.
ask me all the time, you
Right.
know, how did you find the physician to work with? How did you get lucky to have those relationships? And part of me thinks, okay, well, you know, I think now specifically, like beyond working with you, I think I've benefited from being on staff and having the proximity to the hospital, and having all these doctors that, you know, a lot of them are even my own dental patients now, right? Because there's just so much back and forth, there's so much communication. In networking there. But at the beginning, you know, it wasn't like that. You know,
Sure.
when I
Sure.
started working with you, my office was, you know, 5 miles from here, right?
Yeah. Yeah. So you've
So
developed a lot of
we've
momentum.
grown into this, you know. But yeah, that's what people want to know. Like, how can they emulate what we have?
Yeah. I mean, well, when something works really well, you hear about it, and
Yeah.
it generates, you know, it generates talk and work, you know, verbiage, and people hear. And I'm primary physicians, and also patient to patient. A patient may go back to their primary and say, well, I had a great experience with
Mm-hmm.
Dr. Ely, you know, and they know a little bit about oral appliances. They've heard about it. Do you know what I
Right.
mean? So they say,
Yeah.
hey, and that's where you'll get direct referrals from primary care.
Yeah. Yeah.
Right.
I mean, we don't get a lot of referrals from primary care. I think the primary care referrals go to you, you know, and then you funnel them to us, you know, if the patient wants an oral appliance.
Yeah, I mean, yeah, that's the other pathway. But I know of primary docs that know enough about sleep and would hear from you and would send you patients for sure. you know, they skip us. Sometimes it might be, well, sometimes, you know, it might be easier to get in.
If they're doing sleep testing in their office, but it's those physicians, right? It's
Sure,
those primary care
sure,
physicians. If
sure.
they're doing their own sleep testing, yeah.
Yeah, but I think, you know, in a knowledgeable primary physician that has a reasonable rudimentary knowledge of obstructive sleep apnea knows that oral appliance are a standard of care, and they probably come up with it when a patient comes back and says, you know, I've seen this guy and I'm not doing well on my CPAP and he won't listen to me, and what do you think I can do?
Yeah,
And they would know that. Yeah.
yeah.
Wonderful. Thank you both. So I'm going to ask a question that's kind of like the opposite of this is what's the biggest barrier that you see for dentists and sleep physicians to develop working relationships? And what might be possible solutions to this? What, where are the obstacles in developing relationships?
You want to go first? You want me to go
Yeah,
first?
I think one, I mean, unfortunately, I think there's probably a group of sleep physicians, and we were talking about this earlier,
Yeah,
pulmonary physicians that I've been fortunate that my whole practice is sleep disorders medicine. It's been that way for a long time. So I don't have other things going on. I don't have a pulmonary practice or critical care practice, which would take a lot of time. And so I don't think necessarily, I think the problem might be that there's not enough time in the day to dedicate yourself to all fields equally. And sleep medicine may take the lower echelon, hence it doesn't receive the same attention. And you may not be, the physician may not be so interested in collaboration just because they're just so busy and they just don't have the time. And that's unfortunate, but I think sometimes that's true, especially now with EMR and just the way the practices are. Time is really of the essence. It's really difficult. So I think that's a barrier. It's a tough barrier, right?
And we touched on this a little bit before the webinar officially started too, is that sometimes the physician just does not see the dentist as part of that healthcare team for the patient.
Right.
They think about collaborating with other physicians, but when it comes to the dentist, it's almost like there's this wall. Like the dentist is on the other side of the wall and the physicians are all over here.
Right.
And we're trying to find, we want to work with them, but they're like, no, you stay and you can be like, the tooth mechanics, and we'll be over here and we'll take care of the health of the patient. And sleep apnea is a medical disease. And so it must have a medical solution. And so we'll handle it.
We call that legacy thinking, right?
Yeah.
It's just the way it has been and the way it's set in your mind, and different. I mean, and also different physicians come from different places, right? And they may not be so open to that collaboration. Yeah. And that's a tough one. I mean, that's, you always want to say that's educational, but it's more than that. It's some of it's just the way the legacy is going to be, and it's difficult to overcome that.
Yeah, no, and I think that's definitely a barrier. And then the other thing I think is just, sometimes I do think it's the knowledge of the physicians, like how much education the physician actually has to know that that oral appliances is a viable option. I think that Dr. Rowan's practices cutting edge dental sleep medicine, right? So he knows that this is the option. He knows these are like the AASM practice parameters. We've developed a relationship, but Dr. Rose, do you think all sleep medicine doctors are in that same frame of mind as you are?
Yeah, I think as yeah, I'm going to answer that question. Yes.
Okay.
I think that physicians that practice sleep medicine really value dentists and really value oral appliances.
That's great for everybody listening on this call right now.
Yeah, I think
that's what they want to hear, right?
I think they do, and I think if of course there's going to be outliers, right? With different, with different thinking issues and different prejudices, but I think I would say in 2024, it's really it's considered a standard of care in a 1A, 1B option for sure. That's how I present it to my patients.
Right.
I talk about positive pressure therapy and oral appliance therapy in the same breath, right? because they're both really viable and they're both important. And they're obviously, qualify that by saying, obviously there may be cases where they're not quite the same, but many times they are, and we present them as an educational piece right up front. So, and I do believe that sleep physicians do the same thing. You know,
Thank you
that's
both.
that. Yeah.
The next question would be, what advice would you give to dentists who are just starting to treat sleep apnea with oral devices in their practice?
Yeah, that one I can answer, I think.
Okay.
And so I'm approached by dentists who, not necessarily younger dentists, but dentists have an interest in sleep disorders and oral appliance therapy. And what the biggest turnoff to me is not wanting to be part of the team, not wanting to include me. We'll do the study, we'll make the oral appliance. If it fails or something, I think it's got to be truly collaborative. And if you develop that, it's a confidence and it's a dedication that comes through. And I think that would initiate the collaboration and make that to be more of a successful relationship. That's how I feel, because that's happened. I do get approached, and the turnoff is just that, I'm just going to do this because I took a course, but I really consider myself to be a true dentist and not a sleep dentist. I'm doing it as an aside. I want to see.
They're kind of dabbling in it a little bit.
The dabbling. Right? Yeah, I use that word, dabbling. I want to see the commitment, because to me it's really important, because when I'm sending my patients there, I'm making the statement that I believe in you as a practitioner, right? So,
I would say in that same breath too, that before you, if you're a novice sleep dentist getting in this field, is to get some experience treating your patients prior to seeking out like a back and forth referral from a sleep physician, right? So send your existing patients to your sleep physician in your community and have them do sleep testing and learn how to work together before you start seeing like their CPAP intolerant patients.
Oh, absolutely. And I don't know if this is even practical. If somebody said to me and texted me, I'd like to come see what you do, I'd like to spend a couple hours with you, that would be a pretty good start, wouldn't it?
Yeah, absolutely.
I would accept that. I would say, this is how you become really good at what you do. As you did, right?
Yeah.
It was a long time ago, but didn't you come to the clinic with me?
I did.
Yeah.
I did.
You were just a kid.
I saw you set up people for sleep testing. I saw you look over raw data from sleep PSGs. We did it all,
Right. Yeah.
And it was great. It was great.
Look what happened. Look how it established such a great collaboration. So it was you, but that would be a reasonable process to try to get into if you found a physician that would be, mentoring. You could even say that. You could even say, would you mentor me a little bit? Would you mentor me? I'm really interested in that. I would accept that.
Yeah. And I think when I look back and I reflect, I was looking for a mentor.
Yeah. Yeah. I think that's a great idea. And I'm sure you get turned down a lot, but you have to find the right person, and the right person, then it'd be the right collaboration.
Yeah.
Yeah. Thank you both. I was processing from the laboratory perspective and the challenges that we see where, of course, it's not the majority, but we sometimes get requests for oral devices from dental clinicians that really don't understand, and they just say, hey, make it work, or just give me an oral device, and they don't quite have all the information. So I get it. You have to have dedication. You have to really care about what you're doing, about your patient's best outcome, and you have to be educated on what you're doing and have the right resources to take care of your patients. So
yeah, that's a tricky place for you to be too, Frank. Like, I'm going to give you this medical device, and I know you don't know what you're doing.
Well, we certainly don't make it easy.
Yeah.
But it's for the best. You know, we really our goal is to educate and hopefully recommend educational opportunities for those clinicians when that does arise.
Yeah,
Thank you.
definitely.
Thank you. So next question is, does the type of oral device matter, you know, to the MD? Dr. Owens, do you really care what type of device a patient gets?
Um, so just like any other subspecialty and referral, you know, the answer is I trust who I'm sending the patient to. So I truly would leave that up to the discretion of the qualified dentist. Because Dr. Ela, I've always said to her, how about a tongue retaining device? And she would just laugh at me. So there I decided I would just defer to her.
Yeah,
Well,
I mean, I wouldn't expect that Dr. Rowans would know, you know,
No.
the difference between a dorsal fin device, a herpes appliance, you know, I mean, there's no way. I mean, he's got enough to worry about, right?
Right. No, I just like, of course you would choose the right thing. That's why I would choose you. I mean,
Yeah.
same thing, right?
awesome. Thank you both.
Yeah.
Thank you. How can dentists identify the right type of oral appliance for their patients based on different severities and types of sleep apnea?
So I wouldn't say it's necessarily based on severity, but I would say it's based on how the patient presents. You know, if I have a patient that, for example, is a big heavy bruxer, you know, I'm going to make a certain type of determination for an appliance. If I have a patient that is a gagger, or if they're claustrophobic, or if they have a really large tongue, you know, if they only have partial dentition. I mean, those are the sorts of things that I'm looking at when I'm choosing appliance, but not necessarily based on severity.
Got it. Thank you. Thank you. So in cases where oral appliances aren't fully effective, what are the next steps dentists should take in partnership with sleep physicians? So what should, you know, the dentist do if something's not going well with their oral device?
Well, sometimes, I mean, Dr. Rowans knows, I mean, sometimes, you know, the patients are non-responders, you know, or they get a subtherapeutic response to the appliance. And at that point, you know, of course, I'm going to let them know. I'm going to give them that feedback. And then, you know, I mean, I send the patient back to Dr. Rowans to discuss alternative therapies. Maybe it's combination therapy, maybe it's surgery, maybe it's a hypoglossal nerve stimulator. I mean, it's like at that point, I think, or maybe we need to add some sort of positional therapy, bariatric surgery, like something as an adjunct to where that patient is clinically at this time. But I kind of defer to him.
It's interesting. Patients that come back that are non-responders, sometimes they're more interested in reattempting PAP therapy again.
Yeah.
But we do talk about, you know, there's always other creative issues. You know, weight reduction is a big issue now with weight reduction medications. We do talk about surgical interventions, and of course, hypoglossal nerve stim is big. But then sometimes these patients are not interested in either, and we may do more creative things like positional therapy. There are some other negative airway pressure type things. There are, you know, Excite OSA. I mean, there's some more non-conventional treatment options that we might discuss with them. But what I seem to have experienced is that patients, they think this through, and they may have felt better a little bit with the oral appliance. It may have worked for a while, and they tend to be, at least in my experience, open to maybe trying PAP therapy again, or we might do something different with PAP therapy. We could consider bilevel therapy or something like that. And the other thing that happens a lot is there's always newer devices, there's newer interfaces, there's newer masks, there's things. So the technology constantly is evolving and improving. So if it's been a bit, there's always that opportunity to try them on new interfaces and sometimes even new modes. So that's not a bad option. And when the patient does come back, it kind of means that they're still really interested in pursuing therapeutic options, which is good.
Yeah, and now they've seen what else is out there too. And they know
Right.
that, oral appliance didn't work for them. They're more motivated, right?
Exactly. Yeah, that's I
Yeah.
mean, yeah, that's a good word. I like that word. They're more motivated.
Yeah. Yeah.
Thank you both. So I'll ask it slightly differently. For patients struggling with adherence to PAP therapy, how do you approach possibly transitioning the patient to an oral appliance?
I mean, that's an easy. So when I and my staff educate patients during the initial consultation, oral appliance therapy is really high on the list of education. Always talk about it, and in my view of my practice has always been the more education you provide up front, the better patients may do. Okay. So it's not a surprise where I'll say, listen, we could do this or we could do that. This algorithm might start with positive pressure because the way insurance works, you can actually try something, right? But if it doesn't work or you're not comfortable or you're less than optimal, then we'll definitely simply transition you to an oral appliance. Okay. Now, of course, that's with that being said, severe, uh, sleep disorder breathing with significant desaturations, we don't really have that luxury. We might try to do more with PAP therapy before, but we still may at the end of the line, we may end up still going to an oral appliance or maybe even considering dual therapy if positive pressure therapy is difficult and uncomfortable, maybe secondary to high pressures.
Yeah. And then on that same breath, when the patient comes in, and if they are a severe patient that's coming in and we're going to now try an oral appliance because they were intolerant to CPAP, we go over with them and we educate them about, the expectations of treatment. We don't expect to take your, apnea-hypopnea index down to single digits. We hope to reduce it by 50%. We want to stabilize the oxygen. And we go over with this so that the patient has a realistic expectation before we do anything. So that if they say, "Oh, you mean I'm still going to have some mild to moderate sleep apnea," they need to make sure that they're done with their ideas of CPAP before we get started. If there's any doubt, if there's any, maybe I can do it. We just had one today. Exhaust all your options with CPAP before we go down this road, because some of the patients just they're not perfect candidates for oral appliances. So we'll
Yeah,
send the
sure.
patient back, like go do everything you possibly can. And then if it still doesn't work, we're here for you. But then we feel better about what we're doing and we can live with the results a little bit easier too.
And I imagine the patient engaged in their treatment, right? They understand, they're educated, and they're
Yeah.
willing to take those next steps.
Yeah. Yeah.
And
Absolutely.
And I have to add this. I think it's this may be obvious, maybe it isn't, but to get a referral back from a sleep dentist that says, this patient isn't optimal, I don't really think this is a great choice, I have a lot of respect for that, because you didn't just choose to make the device.
No.
You put
No.
you not in particular you, but the outcome of the patient was way more important than fabricating the device. And
Right.
that's, I mean, there's an integrity piece there that's really important. And I think that says a lot, right?
absolutely.
You would
So you're
hope that
talking
that would
about
be a given.
you're talking about the collaboration, you're
Yeah.
talking about that mutual respect and integrity. And that's, it's great. And the world is filled with people that don't have as much integrity, right?
Mhm.
So I think it's a
That's
great
true.
thing to see, right?
Thank you. Thank you both. Next question is I think about comfort and therapy not always being comfortable, right? It's therapy. So what can dentists do to educate patients about the importance of compliance with oral appliance therapy? And how can we address issues like comfort and adjustment?
I mean, I think a lot of that is just really, the troubleshooting, right? So if patients are going to have a difficult time with their oral appliance, if it's a TMJ discomfort or if it's, a muscle strain, I mean, usually there's a reason and we have to dial into, why we're having this side effect. And then we need to be able to figure out a way to mitigate the side effect, right? Whether it's with, like hot and cold compresses, or it's with pain medication or an adjustment of the appliance. But there's usually a reason that the patient's having discomfort or having a difficult time adjusting to the appliance. So just try to, mitigate side effects the best we can, and being knowledgeable enough to mitigate these side effects. Even if that means, maybe you delivered an appliance and your midline was off, and then you have to be able to own up to that and, say, you know what, yeah, this, we're going to remake something for you. So I think being able to recognize when maybe something didn't go right too, and we're all human. But things like that. I think in terms of educating the patient in terms of being compliant, I think that that's, again, something that, when we make the appliance for the patient and we're explaining that to them, this is how the process is going to work, and we're going to get all your records to make the device. And then, 3 weeks later, you'll get your appliance. And, after, we're going to wait 6 weeks before we do a sleep study, and explaining to them that, the appliance doesn't work on demand. It takes some time for that inflammation to come down from all the years of snoring. And so to understand that if they're not wearing it consistently, it's not going to show efficacy. So if we want to get good results, and we always tell them, look, we're going to do a study here to see how it's working, and then we're going to send you back to Dr. Rowan's. And he's going to be the final one to give you that final sign off to say that you're being medically adequately treated. So again, deferring back to Dr. Rowan's for that.
So I was just going to add that, you've also taught me about certain things. So I emphasize the repositioning device in the morning.
Yes.
That's very
the
important.
Repositioning device in the morning, right?
Yes. Yeah. So I mean, I stress that with all my patients that I follow up when I see them. Sometimes we see people, even though you're seeing them yearly and they're doing very well, sometimes they want to come back and see us. And okay, I see how you're doing. It's working really good. We don't necessarily need to see you, but we can. But I stress the dental component that you've taught me, which is the reposition of it, very important, and to use it every night. And so that's also kind of mitigate side effects too.
That's probably my fault. I tell the patients that they should follow up with you annually.
Yeah, well, I mean, it's a great thing, but sometimes they're doing so well that I say to them that kind of at this point, you have a qualified sleep dentist who's doing a great job. They're monitoring the side effects of your device and your bite and your TMJ issues. And if you need me, call.
Okay, but on that same breath, then, so say the patient is ready for a replacement device, and then we need to reach out to you to get another prescription. So wouldn't you have liked to seen that patient at some point to write that prescription?
You know what? I mean, that's a good point. That we're lucky that we have such a great relationship that
Yeah.
if it's been within a couple years and I see they're doing well, do I mandate that they come in and see me as long as I know you're seeing them and I trust you?
Okay.
I'm okay with it. I mean, personally,
All right.
I'm okay
Well, that's
with
good
it.
for
Now,
me to know too.
yeah. Now, if I didn't, if we didn't know you or trust you, I'd probably want to come back. And if it was someone else I wasn't as familiar with, I might want to reestablish that care and then make sure that we were on the right track.
Yeah.
But when fortunately, we have such a great relationship that it's and trust that I don't personally have an issue with that.
Great.
Thank you both. I want to touch a little bit more on the side effects, and I imagine pretty much most, if not all, therapies have some form of side effect. When talking of oral devices specifically, how much emphasis how much education or emphasis is placed on possible side effects and having the patient own their body and understanding, the treatment will help you if, some things may go a little bit sideways.
Yeah, I mean, I think, as Dr. Ross was touching on, the importance of doing the repositioner in the morning. We explain to patients, why the repositioner is important, when we're protruding the mandible, that the lateral pterygoid muscle is in contraction. And then when they take the appliance out in the morning, they're going to feel like their bite's off because that muscle's contracted. So to stretch the muscle back out, we're going to give this repositioner. It's basically like, a little exerciser for you. And that's going to stretch your muscles, and that's going to prevent bite change. So, the most common side effects we see are these patients that, maybe they do the repositioner initially and then they get comfortable with it and they don't think they have any bite change. So instead of wearing it for maybe the prescribed 15 minutes, they wear it for 2 minutes. And instead of doing it every day, they maybe wear it once a week. And then you start to see, okay, now my patient's developing this, posterior bilateral open bite. And we can work with them. There are exercises that we can do, like isometric lateral pterygoid contractions, that we can do to try and get that bite back a little bit. But that's something you're asking me, how much emphasis put on it. I mean, we talk about it. We go through that informed consent before we make the appliance, and they know what they're getting into. And we tell them the most common side effect is bite change.
Thank you. Yep. Wonderful, wonderful. How
Not
does
with
the,
your appliances, though, Frank. With your
oh no, that
appliances,
never happens.
with
No,
your
of course not.
appliances, there's no side effects, no
No.
problems ever.
Thank you. No, and we know that there are known side effects. I mean, possible
Yeah.
tooth movement, orthodontic movement, and things like that. And it's just one of those things that, from the patient's perspective, understanding that things will happen, but at the
Yeah.
end of the day, am I better? Am I in a better health today because I'm being treated for this medical condition? So
Right.
I appreciate that.
Yeah,
Thanks for
and
the
it's a trade-off, right? You might have a little tooth movement, you might have a little change in your bite, but you know what? You're getting your sleep and related breathing disorder treated, and you're going to live a longer life, and you're going to have some of these comorbidities warded off. It is a trade-off. But we tell them, like, just like with CPAP, there's side effects. With oral appliances, there's side effects too. So we really, really don't sugarcoat it for the patient.
Wonderful. Thank you. Thank you. All right, next question is, are there any emerging technologies or research the dentist should be aware of to improve the treatment outcomes of oral appliance therapy?
It's a good question. Well, I think any therapy that improves apnea would improve oral appliances. So, like we were talking earlier, if a patient has a weight-related sleep disordered breathing and they're on a weight reduction program, the oral appliance is probably going to work better, right? So I think that's it. And maybe within the next couple of years, there may be medication effects that may have mild improvement in AHI and sleep disordered breathing. And I'm just surmising that maybe the combination therapy might be something that in the future might be something to think about. So I think that's a little premature, but those type of combinations certainly make sense and may be kind of reasonable opportunities down the line. Certainly not today, but other than the weight reduction, but certainly I would say in the next couple of years, we hope.
Yeah. I think from an appliance perspective, to answer that question, I think, for a lot of patients, probably a mandibular advancement device is not necessarily the answer. A lot of these patients have really narrow maxillas, they have midface deficiency, and, a lot of the newer studies are coming out where we're actually doing, palatal expansion in adults. So, some of these MARPE and dome type procedures that are being done. So, and once we realize that, the floor of the nose is the roof of the mouth. And so, if we can expand there, we get better nasal breathing. So, we could, sometimes a patient is so narrow, we can advance all we want. They're not going to get the results we're looking for unless we do some expansion. And so, I know that I saw a study recently, the older the patient gets, it's harder and harder to expand that mid-palatal suture. And the success rate goes down in these expansion techniques. But, it's something that I don't know a lot about right now. I'm learning. But that is probably on the horizon.
Thank you. Thank you both. All right, so with way over 100 devices on the market, what is your criteria for choosing the right device for your patient? I know you touched on it a little bit. With regards to
I think it's really how the patient presents. I think material is important, whether you're going to make something that's milled, has precision fit, something that's going to stay clean, something that's comfortable. Whether you have a patient that you think you want like a soft liner, or if they are a patient that's like orthodontic treatment and you want to, be more concerned about keeping their teeth in alignment. There's all different things that we think about when we're choosing appliance for the patient. And usually what I'll do is kind of narrow it down to two choices that I think are both good, viable options for the patient. And then Sarah, my assistant, will go over those choices with the patients and let them choose. And again, I think it's important that the patient, kind of owns their treatment and is part of their decision making. And I think that once they're choosing something, there's better chance they're going to adhere to their treatment.
There's that commitment.
Yeah, exactly. So it's their health, so let them pick it out, right? But I give them usually two recommendations and then let them decide.
Wonderful. Well, thank you both. That's the end of the questions. I would pass it on to Trish and hand off to Trish. And Trish, do we have questions from the attendees?
Yeah, excellent. Well, thank you both. We do have a few questions rolling in. I'm going to talk a little bit about True Function for just a moment. So while I'm doing that, make sure you put all of your questions in the question and answer box, or select the raise hand button if you want me to unmute you. So I'll give you just a few minutes to get all your remaining questions in, get your hands raised so you can ask those questions that you may have lingering from the discussion. So as both Dr. Ely and Dr. Rowans mentioned, it's always incredibly important to make sure that these patients are in treatment all of the time, not just some of the time. So we're running a really wonderful special that if you order a digital sleep device, you can actually get a duplicate at a significant discount, so that patient is always has a backup in case anything happens, the dogs get curious, that type of thing. There's always a backup there. So that is running through the end of the year. So feel free to keep us updated if you have any questions on that, or you want to do a backup device when you order that sleep device. For those of you that are new here with the True Function, if you want us to assist you in any way regarding your appliances, or even getting connected with education with Dr. Ely or anything along those lines, feel free to reach out to us. Complete a new account form. We'd love to assist you in any way we possibly can. All right, let's see here. Looks like the first question in the question box is, she is fee for service for appliance therapy, and she finds that some physicians don't refer to her because she doesn't accept insurance. What's your opinion on that, Dr. Rowan?
Well, I think that that's from a practical standpoint, that is a little bit more problematic. One of the things I've sort of learned through the years is that patients in the medical practice expect insurance to cover everything. And even in the early days, remember, Andrew, that patients would come back and they say some things weren't covered, and they would have, I think you might have used the word sticker shock, remember?
Yeah.
And that's just, it's a cultural thing. It's part of the society. And that's, you can understand that. I think that would be a significant barrier for a lot of patients, because it is a relatively costly expenditure, and they're not used to that. So if in fact that was an issue, I would probably have to sit down and discuss it with the patient, and and sort of list off the pros and cons, why we would want to do this, why we wouldn't. And once again, then it becomes a financial and medical decision at the same time, which is always going to be a little bit more difficult, right?
Yeah.
So that, how do you feel about that?
Yeah, I think part of the question too was, is it a barrier for a physician to refer to the practitioner that doesn't take insurance?
Not necessarily. I don't think so.
There must be other things that are like concierge type things, right?
Yeah, I don't think that in itself is a barrier. I think it just may be a barrier for the patient, but no, I wouldn't personally find that to be that much of an issue. But it would be a concern. There's no question about that.
Yeah.
Excellent, thank you. The next one is, should a sleep dentist preferably establish communication and rapport with the patient's sleep specialist or primary care physician? In my local area, it seems that many sleep specialists are located in different cities and are conducting virtual consultations with patients in my area.
Then the question was what?
Should a sleep dentist preferably establish communication and rapport with the patient's sleep specialist or primary care physician? So it sounds like some of them are not local in the area. Should
Yeah.
this provider get to
Yeah.
know whether they're virtual or not?
So certainly the landscape's changed a lot, and I personally don't do telemedicine, but telemedicine really works well with sleep disorders. So it's kind of a natural. And once again, there also may be a deficiency of sleep disorders in the area. They may not be that local. So we talked about face-to-face visits. I mean, maybe that might not be as easy as it is in certain locations. I think then you would just have to reach out and just be creative in other ways, I think. But that is certainly a legitimate concern that I think a lot of sleep disorder consultations, and there is a big focus on telemedicine in the field. So establishing this relationship and, collegial relationship might be a little bit more challenging, but I'm hoping some of the younger dentists and sleep physicians would know how to do that.
Yeah, definitely.
But you think that's important, is what you're saying?
Yeah, absolutely.
Yeah, I mean, I see one of the models being taught out there to dentists specifically, because so many dentists have a difficult time establishing the relationship with the sleep physician, is that they're being taught to, conduct or recognize, say, a patient in their dental practice that they think needs a sleep study, and then have a doctor do a virtual telemedicine visit with that patient. So it's a doctor they don't know, but they're doing a telemedicine. That way it satisfies the requirement of having a face-to-face, and then that doctor is sending the sleep study. But yeah, it's just not the same.
Yeah, unfortunately, that model isn't really the best model, and it's probably
No,
not
I
the
don't think
greatest
so
model
either.
for outcome. But that's the current way of the world. So
Yeah,
those are all issues that we'd have to kind of overcome.
right.
That's why our relationship, fortunately, has been so special, because there's a location piece, right?
Yeah, definitely.
Yeah.
Yeah, both local and
that's and we've had that as an advantage, so that's to our advantage for
yeah,
sure.
most definitely.
Yeah.
Excellent, excellent. Well, that is all the questions we have here. If anyone has any last minute, go ahead and throw them in the question and answer box. But if you want to join us for our next webinar back on that insurance topic, we are going to be discussing medical billing with Courtney Snow on December 11th. So all things medical billing for sleep and TMD, including those new buzzword codes that are coming out for those sleep appliances. So join us December 11th. You can find that right on our education page on our website. And that'll get you right to the registration page to join us then. We will be sending out a recording of the webinar this evening. So we will get that in your email. Give us just a few days to get all of that put together, and you'll see that probably early next week.
Thank you,
I
Trish.
don't see, any final last questions. So thank you both so much for joining us this evening. It was so
Thanks
wonderful
for
to spend the
having us.
evening with
Yeah,
you.
thank you very
and
much.
Spending your time.
Yeah, thank you,
Thanks,
Dr. Rollins,
Dr.
Dr.
Rollins.
Ely.
Thanks for letting me drag you along.
My pleasure.
We
I
appreciate
think
you.
we have one
Absolutely.
last minute question, if you want to stick around for
Sure.
just a moment. As an RDA, how can I help my doctor with gathering patients and collaborating with sleep physician offices? I think this is a good one.
Well, I think that I don't think the assistant can do it. I think the dentist has to do it. I mean, I think you got to go out there and you have to shake hands with physicians and you have to meet them. I think this is one thing that you can't really delegate. I think you've got to do it.
So encourage your boss to go out there and get it done.
Yeah, that's really what I think.
I agree with that.
Yeah.
Mhm.
But wonderful to support them. That'll
Yeah, absolutely.
help on the flip side.
Yeah.
Yeah, wonderful. All right.
Thank
Well,
you.
everyone, have a good evening. Thank you again for joining us.
Thanks.
We'll hope we see you in December on the 11th. And if you need anything in the meantime, don't hesitate to reach out. We're happy to assist you in any way we can.
Thank you again. We appreciate you, Dr.
You're
Owens,
welcome.
Dr.
All right,
Ely,
thank you.
and
Good night.
Trish.
Thank
Thank
you.
you.
Have a good night, everybody.
Bye.
Thank
Thanks.
you.
All right, have a good night.